and welcome to Community with me. We are here. Today is January 28th. It's Wednesday, of course, because we're in the community. And I have so many great people with me today. We're going to give you great resources. We're going to let you know it's all about Covered California today. We have so many questions, and those questions are going to be answered. I have a friend of the community, and then I have some new friends of the community. This friend here, I got my lesson last time, Dr. Valencia Walker.
Hi, Melissa. Thank you for having us back with you today.
Thank you. She's going to do the introductions. She's going to train me how to work with little babies, which she does so well at UCLA. Kudos to her for that. And I'm going to teach her how to introduce our guest today. Let's go.
Thank you for this opportunity. So first, I'd like to start off by introducing Dr. Ann Stavron. She is a retired allergy and immunologist and also one of our community advocates. She's on our advocacy committee for the Association of Black Women Physicians.
Oh, let's give her a hand, everyone. Welcome, welcome, Dr. Ann.
It's my pleasure.
We also have Mr. Vitelio Aguilar. See, this is where you're supposed to be helping me not stumble over my words. And he's a really special guest. He works with the California Medical Association Foundation, and they've been really instrumental in helping us get the word out about Covered California here in Los Angeles. So he is our resident expert. He's one of the educator and facilitators for both physicians and for those in the community. So, Mr.
Welcome. Let's give her a hand.
Thank you for having me. Thank you for that great introduction.
So today is all about the information that we're going to give about Covered California. And this is your show. I am facilitating it. Where do we start? It's a big responsibility that we have to inform and educate the people in California. And let's hear all about how this was started. Is it Obamacare? Is it California, Covered California? What is it?
I was going to say, that's actually a great question to start with, and that's usually one of the easier ones. We're going to save the hard, detailed questions. That's what we had to bring in extra reinforcement today.
Yes.
A lot of people refer to it as Obamacare. That was a name that was originally started by people who opposed this program that was being put forth. But it's used interchangeably with the original name, the ACA, or the Affordable Care Act.
Okay.
Now, each state is able to roll it out in their own way as long as they follow the mandates that are part of the ACA or Obamacare.
Right.
And here in California, it falls under Covered California.
Okay.
So that's for all of us living within the state of California, here locally in Los Angeles. That's going to be what you'll use when you're most familiar with it.
Okay, that sounds good. And when was the official rollout date for Covered California?
So official rollout date, I'm going to turn that over to Mr.
Well,
Aguilar.
the ACA, or the Affordable Care Act, came into effect January 1st, 2014. And so from that moment on, people started enrolling in the health exchange known as Covered California.
Okay.
Okay. Every state, as Dr. Walker was mentioning, every state has their own program or could opt into the federal program of the Affordable Care Act, as long as they follow the standards that were set forth by the ACA.
Okay. And Dr. Ann, what role do you play here with us today? I know you're going to inform us of some wonderful things.
I'm the physician kind of educator today. We're going to not only talk about how it affects the community in general, but also how it affects their doctor.
Mm-hmm.
And I know a lot of people do ask questions, am I going to be able to keep the same doctor? How does it affect my doctor? How they're going to take care of me, et cetera, et cetera. So I'm here today to kind of talk about how it affects the physician in the community who has taken care of these patients in the community for several years.
Okay.
And you know, Melissa, one of the things that we notice is that as we've been doing different types of educational series, is we hear a lot of the same questions over and over again. So we actually kind of compiled a list of questions that we can almost read out and try to answer and use that as a part of our discussion.
Okay, let's do that.
Okay, so I think we already touched on ACA versus Obamacare. A lot of times people will ask about the numbers, like who's enrolling and how many people have enrolled since it started. I don't know, I probably should turn it back over to because he always gets the numbers hot off the press.
Yeah,
Right.
it
Well,
really does.
speaking of hot off the press, as of January 27th, this week exactly, the number that was released was 9.5 million people nationwide
Wow.
And the 71 total of 7.1 million in the federal marketplaces, and 2.4 million in the state marketplaces, which California is one of those. California alone has enrolled in this last enrollment period. They had over 1.2 million people enrolled.
Wow.
And the only other state that beats California in enrollment right now is Florida.
Really?
Yes.
I have a question. What's the difference between covered California and, like you say, the federal market, and if you get like Medi-Cal? What are the differences with those three entities?
The federal market place is basically the Affordable Care Act, the federal government's program. The states had the option to either follow that and use that,
Okay.
or develop their own. Covered California is the state of California's health market exchange. Medi-Cal is still what it's always been, public insurance program. The only relation or the only thing that you see regarding Medi-Cal in Covered California is the eligibility requirements. And this also goes into the reforms that the Affordable Care Act brought about. California is one of the states that expanded its public insurance program, or expanded Medi-Cal for that matter, so that the more people would be eligible and more people would qualify to receive Medi-Cal. In the past, you had to be 65 or older, disabled, or blind, pregnant, and have children. And your income had to be 100% of the federal poverty level or less.
Oh, wow.
Now, with the Medi-Cal
Well,
expansion,
before you go any further, do most people know what the poverty level is, what that dollar amount is?
I don't.
So it's like 16,000
it's,
a year
for one individual.
for one person. So one
Wow.
person making $16,000 a year is considered poverty. I think most people would look at their poverty and need a couple of more dollars added on to that before,
Right.
with 16,000, you don't necessarily feel like you have the ability to do a lot. So as Mr. Aguilar was saying, it was fairly restricted. So I just want, because sometimes people hear that and they
That
don't
paints a
necessarily
picture.
know the numbers that are associated with it. Like 16,000 is just barely making over $1,000 a month.
Wow.
And you think about paying your rent, paying for food, paying for transportation. So it's a very low bar.
It really
Right.
is. That paints a picture for us.
And to continue with that, so actually the federal poverty level that is allowed now for eligibility for Medi-Cal is 138% of the federal poverty level now. So it has increased. It was much lower before. So this opens the door for a lot of individuals who otherwise would not qualify to get public health insurance, and also opens the door for a lot of families as well.
Well, that's wonderful. It's wonderful that we have it. I think often times, what would we have done if we didn't have it? What do people do? What are their options? if you
So
don't
that's
have
a great
insurance?
question. So one of the things that we see is that people say, oh, I don't want to pay for that. But you're already paying for it because people will use the emergency room as their doctor.
Oh,
And getting
yes.
care from the emergency room is very, very expensive. But we have laws that say if you show up in the emergency room and you need care, we have to care for you whether or not you can pay for it or not. But what ends up happening is that creates a ripple effect, because then it takes away resources from people who need it. So by bringing more people in under who weren't eligible for insurance before, we feel like we're at least creating an opportunity for people to get healthier. And there's definitely more of an emphasis on preventing yourself from getting sick versus doing what a lot of people do now. I don't have money, I can't afford it, so you're going to wait till way too late.
Right.
And we want to be able to kind of intervene before we get to that point and help more people be able to take ownership of their health insurance options.
Right.
And essentially what you said, what do people do? Well, essentially what happened is there was tremendous health disparities that were created because people waited until they got so sick that they ended up into the emergency room.
yes.
So that particularly for the black and brown populations, or those who don't have money due to poverty, every category, heart disease, diabetes, asthma, they had tremendous disparities with regards to being sicker and unfortunately dying.
Right.
So this, to me, was a sea change with regards of getting everyone health care.
And it was so necessary. It's so needed.
It's so needed.
it seems like it should be our right to get health care. So it seems it's only, it's only fitting that we have it.
I think so.
And it's a wonderful thing. I'm so glad that you all came on, and so many questions to be answered. So many lives at risk here.
Yes.
Like, well, if you have women, and I'm sure you see this a lot, Dr. Walker, if you have women that don't go to the doctor their whole pregnancy just because they think they're okay, and then when their baby comes out, there are problems and issues that are going to
Absolutely.
be
And then
costly.
sometimes, yeah, women will deliver babies very early, and then the babies have to be in the hospital. So there are a lot of things that can be addressed as we look at these different options. I think Dr. Savin brought up a good point about the disparities that exist.
Yes.
Right now, this is a stepping stone. And if you're too sick to work, then you're not going to get a job that maybe has, like, a lot of coverage and different insurance plans. But, if you can stay healthy, if you have choices and options, you get education, and then you can kind of keep going. And so this, once again, creates almost like a wider safety net for people that shouldn't be falling through the cracks. These are people that want to work, that want to, take care of themselves and take care of their family, but just real insurance was so far out of their reach and not being able to afford a lot of the other things that were out there. So you'll hear a lot of negative things about Obamacare or ACA. Nothing is ever perfect, but in terms of the goals and the vision that were set forth, we're definitely working very hard to try to move in the right direction.
So we would want to get rid of those misconceptions, and we want to get rid of those myths that are out there for everyone. This care is for everyone that needs it. It's there for you. So why not take part of it?
Right, and I think one of the goals of the CMA Foundation and NEPO, for example, is to get out there in the community and educate the doctors so that the doctors are also familiar with what's going on, because it's so much new information to take in. And as you said, there's a lot of myths that are going around. For example, we always hear about doctors saying, well, I tried to take Covered California. I thought I was automatically included in the plan. The reality is that every doctor has to get a Covered California contract with whatever carrier they work with.
Okay.
So, for example, if you are a Blue Shield doctor, if you have a contract with Blue Shield, you would have to actually get a Blue Shield Covered California product contract in order to see those patients and to be able to get reimbursed for those services that you're providing. And so that's very important for a lot of doctors to know, that they need to contact their carriers and let them know whether they want to opt in or opt out of those contracts.
Another myth that, from the physician's point of view as well as the doctors, at one point they were talking about the death panels and the government would decide what therapy you would get. But essentially, and I think that the young man can back me up, if you look at Obamacare, there's nothing in Obamacare that tells you what therapy to use, and there's nothing in Obamacare that requires an authorization within that bill. Now, your own insurance plan may, but there's nothing in the law that dictates how your doctor is going to treat you. So I want to make sure that the doctor and the patient understand that there's not a government entity that's going to come in between them that will dictate how they're to be treated and when they're to be treated.
Okay, that's good information.
A lot of the reforms that came about as a result of the Affordable Care Act are basically trying to improve accessibility. And some of the things that we saw with the effect of the Affordable Care Act coming into effect was now there's guaranteed issue. Okay, so you cannot be denied if you have a pre-existing condition.
Right.
You cannot be denied if your health status is not up to the insurance company's standards. Okay, and then another big one with which I think we spoke about this on Sunday. With we're in 2015 now. As a result of the Affordable Care Act, there can no longer be premiums based on gender. So, for example,
They did that?
Yes.
Absolutely.
Really?
So you got one price if you were a man and a different price if you were a woman. And an older woman really would have a
Really?
very different price.
Oh, wow. So no more of that.
No
No
more
more
of that.
Now, the other thing to remember, and I'm glad that Mr. Aguilar is bringing up some of these topics, we are trying to improve accessibility. So, for example, if you are a woman, and a different price if you were a man, and a different price if you were a woman. So you got one price if you were a man and a different price if you were a woman. And an older woman really would have a very different price.
Oh, wow. So no more of that.
why it's important to be educated on this is that if you are getting insurance for the first time, then you'll have to understand it's a different way of doing things, and you have to understand a lot about like what your copays are, what your deductibles are. So you can pay into a plan, but you have to look at your different plans based on how much money can I put out up front, or do I think I might need to put out up front when I utilize my insurance. So it's not just, oh, I have insurance now, I can just go to the doctor and I don't have to pay anything else. So we want to make sure people understand that aspect of it as well. And those prices are going to vary depending on which type of plan that you get enrolled in under Cover California. But it's even true, like if you think about car insurance. Like I think about when I buy my car insurance, they're like, well, you can pay this much a month, but your deductible is going to be $1,000.
Right.
Or you can pay this much a month and your deductible is only $500. And so you have to think, where do you think you can balance that cost? Do you want to roll it out over a monthly basis? Or do you want to say, I think I can go a whole year without anybody hitting me on the 405, the 110, or the 101. I'm willing to take that risk, so I don't have to. So, but if you think about it that way, your insurance for your health works in a similar fashion.
Right.
And just making sure people really understand those numbers and finding numbers that work for their family, for them, for their household, and really paying attention to what those numbers
And
are.
so basically there are no excuses. This plan is for everyone. It is affordable. It was made for the people who need it, maybe need it the most, because I had insurance through my job for 25 years and I lost my job, and my God, I was like, what am I going to do? So I did start to research Cover California, and I did start to find out there's a platinum and there's a bronze
Gold,
and
silver,
gold and silver.
bronze.
I checked into all of that, and it was actually better than what Cobra was offering me after being laid off from work. I think Cobra was $752 a month to keep Kaiser.
Cobra is a shock when you lose your job.
Cobra's a shock. It's like, I just lost my job, so how am I going to afford that?
Yeah.
But this is something that's wonderful, and I want to know, how do they learn about it? If you just have people that just don't know. Sometimes people, they just don't know. How do you get to those people that don't know? And
Well, definitely there are different organizations all over Los Angeles. I think there's going to be a pretty large health fair this Saturday with KGLH is going to talk about Cover California. Our organization is going to do another event in the community, probably in the Lamar Park area in the next couple of weeks. And so you'll hear announcements about that. But you can go to the website. And then, Mr. Aguilar is here. He's going to leave his information as well, because you can go to the CMA Foundation. So we're a part of, he mentioned NEPO. That's the Network of Ethnic Physician Organizations. So it's not just the Association of Black Women Physicians. We're here with you today.
Yes.
But it's all the other ethnic physician organizations, Vietnamese, Korean, Armenian, yes. The Armenian Medical Society is really big and really active here in Los Angeles. They're a great group to work with. And as we touched on, we touched about Black and brown people having these disparities. So our organizations are all trying to work together to, get the word out. And we want to touch people directly. So, we're here today. If people have questions, they want to invite us out to, talk to their doctors, or maybe talk at their churches or their community centers. You can definitely reach out to us, and we'll try to get to you, especially before February 15th.
what's special
That's the
about
date.
that date?
So,
Dr. Stavron?
Well, the new enrollment period for, I believe, the 2015 year was November 15th, and the last date is February 15th.
Oh.
Now, there's two major consequences, and I'll let the young man go into it in a little bit more detail. For one, if you're not covered, when tax time comes, you're going to pay a tax penalty. And two, you may not have coverage if you don't get in within the enrollment period. Your coverage will be delayed. You still may be able to enroll, but it will be delayed with regards to, you can't just at the end of February or March start up. So that February 15th, people should get on the phone, get online, and try to meet the deadline, I think.
So right. So it's a little bit over 2 weeks where people have that timeline to be able to enroll. The best thing for them to do if they don't know where to go is to look up coveredca.com, or they can also go to thecmafoundation.org. And they can find resources in their community where they can go to find a certified enrollment counselor or an enrollment specialist to help them with the application, and also answer any questions they may have.
So we're going to take a break. My time flies.
Yeah.
I want to know, I have one question before I take this break. Who gets turned away from Covered California?
No one necessarily gets turned away. They just get guided into another direction. For example, if your income is too low, as we mentioned earlier, you would qualify for Medi-Cal. So
Okay.
you would get bumped down to Medi-Cal. If your income is too high, you still can purchase health insurance through the Covered California Health Exchange, but you would not receive any subsidies.
Okay.
That would be the only difference.
So anyone that calls is going to get assistance.
Right.
Yes.
Anyone that goes online will get assistance.
Right, and there are also a lot of tools online where they can plug in their income and see what kind of plans they qualify for, what kind of plans are available. It will give them an estimate of what their premium might be on a monthly
Okay.
basis. So there's a lot of information available to them.
So this is a push for you and everyone you know. We got to let everyone know. You get your Covered California before February 15th. It's there for you. Otherwise, you'll be penalized during tax season. Very important. These things are things that I didn't know. We need to make sure each and every one of our loved ones are covered. Period. Let's take a break. We'll be right back.
Diabetic, need some energy? Need to quench your thirst? Try Pitbull Sugar-Free Energy Drink, the only energy drink named suitable for diabetics by the American Diabetic Association. And it's now available with no calories, no carbs, no sugar, and no fat, and a smooth, natural blend of energy, vitamins, and minerals. Need to quench your thirst? Try Pitbull Sugar-Free Energy Drink, the only energy drink named suitable for diabetics by the American Diabetic Association. And it's now available with no calories, no carbs, no sugar, and no fat, and a smooth, natural blend of energy, vitamins, and minerals. Pitbull Sugar-Free Energy Drink is the healthiest, best-tasting energy drink around. For more information and online ordering with free shipping, please visit hiphopbev.com. Remember, Pitbull Sugar-Free Energy Drink, suitable for diabetics, great for everyone.
And we are back. It's all about Covered California today. We have Dr. Ann with us, and we have Vitilio Aguilar. He's here, and he's from the CMA. We want to touch more on some of the things that you think are very important. Can you share 3 topics that are very important with us? 3 things that you think we just have to know.
Well, we touched on the deadline for the enrollment period, February 15th. It's very important. We also touched on the penalty. Now, the penalty, if you do not have health insurance by the tax time, when tax time comes around, you will be charged a penalty. That's 1% of your annual income. Or I believe the first year it was $95. It has increased since then. And there is a max for family, but you will have to pay a penalty. So you have to make a decision what is more important to you or what is more affordable to you.
Right.
And the other thing is information. The information is there. It's just a matter of getting to it. When you talk to certified enrollment counselors, ask them everything that you want to know,
Right.
and then also let them know that you are not familiar with how insurance works. The population that is enrolling now, a lot of these people, a lot of our community members or family members, friends, they have not had health insurance before, and they have not maybe read the fine print on the benefits that are available in their insurance. On a personal note, I've like you said earlier, I've been in working for about 16 years of my life. I've always had a health insurance through my employer. I never bothered to read what my deductible was, what my
Right.
copay was. It wasn't until I got to the doctor's office that the doctor would say to me, "Mr. Aguilar, you have a $25 copayment." Okay, no problem. But for someone who is low income and who has limited resources, it's probably very important to get that information ahead of time so
Right.
that they choose the plan that is best for them. Okay, so that they don't end up with a plan with a large deductible that is out of their range or out of their means, and so that they do get a plan that covers them with the types of services that they need and benefits they need as well.
Right. So there wouldn't be any excuses, we would say, to our loved one like my mother, who is not on social media, and she doesn't have a Facebook, and every time someone calls her, they say, "What's your email?" She goes, "I don't have an email." We want to make sure we help those who don't have internet, who don't have smartphones, who don't have a computer. We want to make sure we help everyone. And I think that we all should take it upon ourselves to ask at least 5 people, are you covered? You don't have to get personal with them. Just say, are you covered? The insurance is there for you. Get your covered California. This is amazing. I didn't know it was this easy.
Right. There's a very big push media-wise, social media. You'll hear the ads on the radio.
Yes.
You'll see the commercials on television. And they'll let you know where you can get that information. You can either call or look up the Covered California website, or even look up at your local nonprofit agency. Most nonprofit agencies in our communities are doing the work to get the word out,
Right.
or also to provide assistance with enrollment and answering questions as well.
Dr. Ann, can you share with us the fine line that might be there between the physician and the patients during this time of uncertainty when people are just not sure?
I would say that this is the time when the patient and the physician should come together and form a unit with regards to taking care of the patient.
Yes.
The patient has to become more educated with regards to their health plan, what's in the health plan, and the physician has to become more educated on the type of coverage and be sensitive with regards to now the patient may have more responsibility with regards of how they're going to be taken care of. So what do I mean? Well, for instance, you just said all these plans. Now, a lot of physicians at this particular point in time may not be familiar with these plans. I think it's the physician's responsibility to come up to speed, and hopefully our organizations will help them.
Yes.
But the patient has to be well informed what type of plan they have, what is covered under their plan. Understand when they go into the office now, there are going to be some changes. You might have seen them. First of all, there is an interface now between you and the doctor. What is that? The little computer. Because that was part of the Affordable Care Act, that we now have electronic medical records. So now your information is going to be on an electronic medical record, and there's a little interface. 2, the way the doctor is paid. The doctor will be paid somewhat on how well they're taking care of you. What is the health outcomes? Not all plans, but that's going to be the goal. So it's imperative that there is a working relationship, even stronger, between the doctor and the patient. The patient must become their own advocate, or the
Yes.
family member. I went to a community event, and I said, if you can't become your advocate or your loved one, you have to become it, or you have to get someone.
Yes.
And don't hesitate to go into the office with the patient and work together, because it's a little bit different. The payment, how the doctors pay, the electronic medical record, and there are a lot of networks. As it was said, the doctor now has to become part of a network or become part of this contract, or unfortunately, your doctor may have to change. Now, I must say that was a little bit of a disappointment for me as a doctor, because initially it says, don't worry, if you have your doctor, you're not going to lose your doctor. Well, that wasn't 100% true. The goal is to get your doctor onto a covered California health organization network so they can take care of you. So it's going to have to be a joint effort between the physicians to come up to speed, the patient now being their health advocate and being well educated. And I actually think for the 21st century, health care is a right and not a privilege, and we just got to make it work.
Yes. And if we have all of the information we need and all the resources, there's no reason why it shouldn't work for everyone.
Exactly, for everyone.
For everyone.
for everyone.
And I think that's what our goal is at the CMA Foundation with the Provider Education Program. We have various representatives like myself who are covering different areas. I myself handle the LA County and the San Bernardino County areas. So I'm trying to reach out to all the physicians I can and let them know I'm here as your resource, as your liaison to Covered California, so that we can answer the questions. I may not have all the answers right away, but I will find out for you. And I can also provide you with materials so that you can provide to your patients, so they can be better informed as well. As the doctor was saying, it's a joint effort, and the community itself has to rise up and educate itself, and the doctors have to educate themselves, and we have to do the educating. So we're reaching out, and we are available to go out to physicians' offices, small clinics, etc., to do presentations covering Covered California, the ins and outs, what you need to know on how to work with it, and things like that. And also just to let you know we're here, to help you, to, again, be your connection to Covered California.
So you can't say you didn't know. You can't say that. Right. But what happens when a person wants to go to their doctor and the doctor refuses them because they're not taking the Covered California and they're not on that network? What happens?
Well, the patient will have to, the best bet would be to contact their insurance provider or carrier, and they would refer them to another physician that is accepting Covered California.
Okay.
Which might be, a headache for a lot of people, because if you're creatures of habit, and you have that familiarity with your doctor, it's hard to make that type of change, and that's understandable. But unfortunately, that's one of the, I guess you could say, speed bumps or growing pains with this new program.
And it may be helpful as you're going through the process, as you're applying, perhaps you should speak to your physician.
Oh, yes.
Before you get to the loggerhead point, I've lost my job, I need insurance.
Right.
Most physicians want their patients to be insured. It's better for both parties. And so perhaps if you broach that subject with the doctor as you're going online, they might not even tell you, you have asthma, and that bronze plan is really not going to be helpful for you.
Oh, right.
Because, it's not covering the things with medication, or you'll be paying hundreds of dollars more for your medication, et cetera, et cetera. So, as I said before, it's really a partnership that should be made. It's still possible they may refuse, but I think if you work with them prior to that, I think very few physicians who've been your doctor is going to say, I'm not going to take care of you because of Covered California.
So we need to do our due diligence, and we need to be fully educated and know what we want, as well as maybe getting a little bit of advice, because like you say, you may say, I'm for the bronze plan, but it might just be in your best interest to step it up a notch, and that may cover your albuterol or things like that, things that may be costly in the end if you don't pay on this side, then you may pay on the other side.
Yes.
That's good information. So what else would you like the viewers and the listeners to know about this great American Health Care Act that we have here?
Don't feel like your questions will not be answered. Don't feel like you will be lost or by yourself. Everyone is having the same questions in the community. The doctors as well, if they feel at a loss and they don't have the information necessary, they can reach out either to Covered California directly or to all the smaller organizations, the CMA Foundation, the Network for Ethnic Physicians Organization, the African Women's Physicians Association.
Black Women Physicians.
Black Women Physicians as well, I'm sorry. Because that's what everybody's trying to do. We're all trying to work together for the same goal, to educate, inform, and also to get everyone covered.
Yes. And Dr. Ann?
I think it's very important to know, remember that there's no pre-existing conditions anymore. To know that the new paradigm for health care is health care prevention to keep you healthy.
Yes.
Rather than trying to rescue you when you're sick. We'll certainly do that, and we'll do it well, but the goal is to keep you healthy. There's no limits on the insurance. I don't know if you realize that there used to be a limit.
Right.
I did pediatrics as well as allergy, and we'd have little babies in the nursery. And if they were premature, that might take several weeks, months. But then the parents would come in and say, well, we reached our $1 million cap or our $2 to $3 million cap. The insurance would stop paying.
Oh, wow.
Right.
So understand that there are no annual limits with this particular healthcare law. There's been a lot of misinformation about it. Everything that requires a change requires a little work, and people get a little scared. But personally, I feel that it's a great thing, and it moves us into the 21st century with regards to the United States of America. All of Europe is virtually covered.
Yes.
China have health care for their populations, and I think this is just a forward step, not a backward step.
Yes. And this is something that is for everyone.
Everyone.
Right.
Everyone is allowed to be on the same page. They are given the same opportunity at their health. What are you
Their
going to
health.
do with it?
Right.
Including your children. Your children are going to be covered under the Affordable Care Act. And I believe, if you go into it a little bit, that health prevention, things that you do to do preventative health, like diabetes checks, and et cetera, those are free.
Right.
Those are
Wow.
free under the plan.
That's wonderful.
Yeah.
So many great things to learn. I mean, it seems as though to me it would be quite exciting. When I thought I was going to use it, I was excited to learn all about the different tiers and where you could go. It's something new, and the gentleman that I spoke with, I remember he was very nice, and he did follow-up emails, and I felt like we were growing into a very professional but personal relationship, where he was actually really very concerned about what I was going to do with my health care. And it was a very nice experience that I had with Covered California.
Oh, wonderful.
And I think, like I mentioned before, the physician organizations that are working in the community, you'll find that with them as well, that personal touch.
Right.
Because everyone believes in this program, everyone wants this to succeed, and everyone wants everyone to get covered.
Yes.
So you're going to find that with a lot of people that are working in this program.
That's a wonderful thing. Can you give us the information about how do we contact you all again?
Sure. I can be reached through email. My email is vaguilar@thecmafoundation.org. Or I can be reached by phone at 310-715-9182. Again, I cover provider education in the Los Angeles County area and the San Bernardino area. And for any resources, information, statistics, you can also contact thecmafoundation.org. You click on the Covered California tab, and there's plenty of resources there for you to print out in PDF file format.
Oh, cool. And Dr. Ann, do you have anything that you'd like to share with us?
I would encourage the audience out there to contact any of the local physician societies. In addition, the Association of Black Women Physicians, which you can get online, and the Charles R. Drew Medical Society. We're all very interested in you keeping the doctors that you have.
Yes.
Relating to the physicians that have worked in the community for years. And I think that the overall health care of our communities will benefit tremendously over the next few years.
Right.
Do you need the email for us, or the
Do we have
online?
that?
Yeah, I think we do. It's www.
Oh, it's here too.
Yes, Association of Black Women Physicians.org, I believe.
www.blackwomenphysicians.org.
Yes, thank you.
They're always here, and they're so smart, and they look just like me, so I always love that. And we want to make sure that we thank Dr. Carol Jordan Harris. I have to say her whole
Why don't you come
name.
up, Carol?
And she's always here, and she's in the wings helping us out, and she's very encouraging, and she's a retired OBGYN, so she has a lot of knowledge. And these women from, I can't say the abbreviation anymore, I have to say the whole thing now, Association of Black Women's Physicians, they pass the torch on to their younger sisters who are coming through the medical school, and it's very difficult. So we want to give them a great big round of applause, because they are great women, and they're always here, always helpful, and always concerned about others. It's our duty, again, I say every day, to give back to others, and that's what they do. Dr. Carol Jordan Harris, she's influential to many women. I know many women that know her, and she's a great leader, and she's a light. And I'm pleased to meet Dr. Ann today, as well as, don't tell me, I had it the whole show, Vitilio Aguilar. I like to roll my R's, so Vitilio Aguilar. Here we go.
Thank you.
We have a lot of great information. We're going to take a quick break. We're going to come back with closing remarks and everything that you need to know. We want to give you a checklist, what you need to do to make sure you and every single person that you know is covered in California. We'll be right back.
Diabetic, need some energy? Need to quench your thirst? Try Pitbull Sugar-Free Energy Drink, the only energy drink named suitable for diabetics by the American Diabetic Association. And it's now available with no calories, no carbs, no sugar, and no fat, and a smooth, natural blend of energy, vitamins, and minerals. Need to quench your thirst? Try Pitbull Sugar-Free Energy Drink, the only energy drink named suitable for diabetics by the American Diabetic Association. And it's now available with no calories, no carbs, no sugar, and no fat, and a smooth, natural blend of energy, vitamins, and minerals. Pitbull Sugar-Free Energy Drink is the healthiest, best-tasting energy drink around. For more information and online ordering with free shipping, please visit hiphopbev.com. Remember, Pitbull Sugar-Free Energy Drink, suitable for diabetics, great for everyone.
We have one more thing that we need to say about Covered California, and then we want to let you know about something else that's very exciting.
Just to reiterate, so I'm available, provider educators are available through the CMA Foundation to come out to physicians' offices to do presentations on the do's and don'ts, or the what you need to know on Covered California for physicians as well as for medical office staff, billing staff, et cetera, because the physicians are not the only ones affected, but obviously the front office staff are dealing with their patients firsthand,
yes.
And the billing staff are also dealing with issues as a result of this as well. So we are available to do presentations for that kind of staff.
Okay.
And we also just wanted to touch real quickly on the Network of Ethnic Physicians Organization, which is doing a anti-sugary beverage campaign. We have posters that are available, just to let you know that one sugary drink can increase your risk of diabetes by 25%. So they are making a push to let people know that if they give up sweets, it's going to be better for their health, better for our overall community's health, et cetera, et cetera. We have these posters available. The object is to spread the word and spread awareness on this. You can take a picture with this poster and just hashtag beat the sweet or hashtag sugarless poor. And you can find out more information at that through the CMAfoundation.org as well. I'm sorry. So here's the poster.
So there's the push also for the anti-sugary beverage campaign, which leads us to Pitbull. The owner of this station also owns Pitbull energy drinks, and the Pitbull energy drink has a sugar-free blend. That sugar-free blend is approved by the American Diabetes Association. So it's approved. It's a drink that if you are diabetic, you're able to drink that sugar-free, or if you don't want to have all the sugar in your drink, that is an option for you. So this is a great thing to know. I didn't know that either. I guess I just learned so much here doing this show. I didn't know that your risk grow so much when you have a drink. And I used to love Pepsi, but I've been delivered from Pepsi, so I drink a lot of water now, and I think that's best. When you go out, if you're out with friends and you're having a lunch, order water or order maybe a tea or something like that. But this is a great push, and we want to talk about this all year long. This is a 1 year campaign, or
it's going to go as forever, as far as it can go,
as far
just
as it
to
can
spread
go,
the word and
just
gain
to spread
awareness.
the world.
Right.
Okay, so there we are. All right. So back to Covered California, we want to talk about the 3 myths and the 3 things that we want everyone to know that are true. Let us know about that. We want to tell everybody, we want to drive it home. February 15th, February 15th, February 15th.
Okay. Again, physicians, they need to check with their contracted insurance carriers so that so they know if they are in the network for Covered California products or not. And then patients should also find out if their doctor accepts Covered California. If they have to switch over, they should check with their doctors first to see if their doctors are accepting Covered California.
Okay.
Also, another thing is if you don't meet the eligibility requirements for Covered California, if your income is too low, you will most likely get bumped into Medi-Cal.
Okay.
And as we mentioned before, as a result of the ACA or the Affordable Care Act, Medi-Cal has expanded in California, so the income level has risen, and more people are going to be eligible for Medi-Cal.
Okay.
If you make over the 138% of the federal poverty level and up to 400%, you will qualify for subsidies through Covered California.
Okay.
Okay, so Covered California acts like a large employer, so they will pay a portion of your premium on a monthly basis, and you will be responsible for the rest. So it will make your health insurance more affordable, and which will give you more access as well.
Oh, wow.
Okay.
And Dr. Ann?
I would say first and foremost, you should form a partnership with your physician or healthcare provider. Number 2, you should educate yourself with regards to your own health and be your own health advocate, or form a partnership within your family unit to be your health advocates. And 3, don't be afraid to look for health coverage.
Mm-hmm.
It is here, it is available, and it's for everyone.
Good stuff. Good. That's a lot of great information. Everything you need to know is here. If we haven't covered it today, you have great resources that you can go out into the world and let everyone know. We've given you the tools, and we've given you enough information that you can share this information with someone. It's a great thing to carry knowledge, especially when it's going to benefit your health and your life, your well-being. When we're healthy, we're happy. I think healthy people are happier people, and that's a great way to be. No worries, no stress. Stress is an illness also, and we want to make sure when you have insurance, you're able to go and talk to someone. You're able to go and maybe talk to your doctors, tell them things that you wouldn't normally tell your friends or your loved ones. They're our confidants sometimes, and we need the doctors in our lives. We really do. So do we have any closing remarks? We've done a lot. Anything that you just, maybe something personal about yourself, that how you feel about Covered California, or what you'd like the masses to know that they just might really not know?
Well, on a personal level, I can tell you that my mother is one of the beneficiaries of this. She's 70 years old.
Mm-hmm.
She is diabetic. But with her new health plan, as a result, she was one of the people who had to lose her physician that she was with for about 20 years.
Wow.
Obviously, like most people, she was very upset,
It's devastating.
but it was a blessing in disguise, because now her plan, she has a young doctor who is very motivated to help her and encourages her. And also, as part of her health plan, she receives a gym membership.
Oh,
So,
cool.
so mom is on the treadmill and
yay,
losing some weight and
Mom.
feeling good about herself and controlling her diabetes, and is feeling really good as a result of this, because her insurance is helping her, and her physician, who is also very passionate about helping people, is helping her as well.
So say hi to Mom.
Hi, Mom.
Good job.
So-
She'd be very proud of you. Very smart young man that we have here, and doing great things in the community
Thank
and
you.
helping others. So we're proud of you.
Thank you. So just to reiterate, I'm available for, if you have any questions or need any further information, you can contact me at 310-715-9182 or email me at vaguilar@thecmafoundation.org.
Good. Thank you.
Thank you so
Give him a
much.
hand.
Thank you for having
And
me.
Dr. Ann, I give you the last words of the show.
Well, I've been a doctor for over 35 years, and I have worked in the communities in Inglewood, in the South Central areas, the edge of Culver City, and then my final 20 years or so in Kaiser. And I must say that for a physician, when you encounter someone who's ill, and it's just the way our system is set up. We are set up as a business, and then you have a patient, and when that patient isn't covered, it's heartbreaking as well for the physician.
Yes.
Of trying to certainly can take care of you for nothing from our point of view, but then there's hospitalization,
Right.
there's medications, and so actually, when I was little, I would say, didn't you say, what's going to happen in the future? What's the future going to look like? Well, here we are.
Here we are.
We're in the future, and this is what the future is starting to look like. And from a physician point of view, I'm very pleased, and I know that there's a lot of bumps, but I think in the long haul, we'll have a very, very smooth road down the line.
Yes. Well said. Let's give her a hand. Dr. Valencia Walker had to leave. She had to go back and take care of the little babies, our precious little ones in the world at UCLA. We're so proud of her, so proud that she's always able to come. And our new friend, Dr. Ann, she's a light here for us as well. Viteo Aguilar. Yes, I can certainly mess up people's names, but I'm trying my best, and that's all we can do is we can do our best. And we also want to make sure we give a big shout out to Dr. Carol Jordan Harris, who always comes through for us. She's very influential in teaching us how to respond to emails and to answer phone calls, and she's a great communicator. I am taking notes and lessons from Dr. Carol Jordan Harris. I thank you for coming into the community. We have key things that we want to remember, and the main thing is Covered California is here for you. February 15th is your deadline. Please don't get fined when you get ready to do your taxes, because that means, wow, you could have paid for your insurance. How about that? So let's make sure we're all covered. Make sure each and every person that we know and that we love are also covered as well. Covered California is here for you. It's here for me. It's here for us all, and we're grateful for it. We want to thank you for coming into the community, and we'll see you next week. Thank you.